Hello, I'm Catherine Amrien. I'm an assistant professor of nursing at Fort Hays State University. My poster presentation is titled Empowering Students Through Experiential Learning Experience. This theory of experiential learning was proposed by psychologist David Kolb in the 1980s. His theory of experiential learning is illustrated on the poster, showing the cyclic flow through concrete experience, reflective observation, abstract conceptualization, and active experimentation. This design allows students to enter the process at any stage and continue through the cycle in a logical order. This process allows students to integrate new knowledge, provides hands-on experience, and allows for active reflection. The structured framework gives faculty the ability to design experiences that provide student engagement and development of critical thinking. Traditionally, nursing education has included didactic classroom lecture combined with instructor-led clinical situations. With the ever-changing field of healthcare, nursing education must adapt to the current demands. The use of experiential learning challenges traditional learning by providing students with dynamic learning opportunities and real-world experiences. Benefits of utilizing experiential learning with nursing students that I have found include immersion in live patient scenarios, which helps to bridge the gap between that classroom knowledge and their clinical practice. Students are given the opportunity to demonstrate the knowledge they've gained and show their social skills during the experience. Kolb's model offers students the opportunity to reflect on the experience and evaluate the activities. This allows students to plan for future interactions and practice. Experiential learning provides the opportunity for interprofessional collaboration with other healthcare professionals. Nursing students work in partnership with other college students in a variety of majors on campus. In addition, they are able to connect with local resources, preparing students for the reality of the healthcare environment. The experience builds student confidence in clinical judgment and skill set. Exposure to diverse scenarios aids students in developing cultural competence, adaptability, and resiliency in the nursing field. Participation in community engagement during the experiential learning experience promotes local relationships in the community and fosters a commitment to social responsibility. Partnerships develop an understanding of the needs in the community, ability to assess determinants of health, and identify local health disparities. Currently, an experiential learning experience being utilized in our facility. We are a traditional on-campus BSN program, and we have initiated this experiential learning experience for second semester senior level nursing students. The experience was designed for the nursing students to participate in weekly well checks for other on-campus students, staff, and faculty near the busy campus quad. These checks include obtaining a blood pressure, pulse, temperature, and pulse oximetry, as well as a brief anxiety screen using the GAD-7 scale and a depression screening using the PHQ-9. Prior to the experiential learning experience, students are presented with the materials they will be using during classroom lecture. Students demonstrate proficiency in obtaining vital signs, as well as becoming familiar with the GAD-7 and PHQ-9 forms. Upon completion of the screenings, nursing students take time to counsel the individual regarding their results. Education is provided regarding specific methods the individual can implement to improve both physical and mental health. Any abnormal results are discussed with the individual, and appropriate interventions, such as referral to primary care or the Student Health and Wellness Office, are initiated. Students ensure the use of culturally competent care to apply appropriately teaching methods and referrals. When discussing individual results, students utilize an iPad that allows them to help facilitate referrals to various healthcare options in the local area. If questions arise, there is a nursing instructor present to assist with the concerns. Oftentimes, there is a known healthcare issue related prior to the individual stopping for the well check. This provides additional opportunities for education and follow-up with the individual. Following the experience, students provide written journal reflection to focus on the interactions and critical decisions that were made during the experience. Reflection includes communication strategies that were utilized during the interaction, visual assessments made during the interaction, health education points the student was able to provide to the participant, follow-up health services that the participant would benefit from. This journal is intertwined with collaborative classroom discussion regarding social determinants of health that were identified, prevention of both communicable and non-communicable diseases, prevention and maintenance of mental health, and identification and prevention of substance use disorders that were identified. Grading of the journal for the experiential learning experience includes the student thoroughly answering the above information, as well as the utilization of a minimum of 2 scholarly references. In addition, students are graded on their grammar, spelling, and APA formatting of the references. The American Association of Colleges of Nursing has developed 10 essential core competencies for professional nursing education. These competencies provide a framework for faculty when developing experiential learning experiences. This experiential learning experience has met multiple advanced level Domain 3 competencies regarding population health. This domain descriptor states, population health spans the healthcare delivery continuum from public health prevention to disease management of populations and describes collaborative activities with both traditional and non-traditional partnerships from affected communities, public health, industries, academia, healthcare, local government entities, and others for the improvement of equitable population health outcomes. AACN Essential 3.2 is to engage in effective partnerships. 3.2a, students engage with other health professionals to address population health issues. Essential 3.2c, use culturally and linguistically responsive communication strategies. AACN Essential 3.3, consider the socioeconomic impact of the delivery of healthcare. And 3.3a, describe access and equity implications of proposed interventions. By meeting these core competencies, students are able to identify the overall population health and local healthcare delivery systems, including the public health department, hospitals, outpatient services, and mental health services available in the community. This experiential learning activity assists in the identification of key stakeholders in the community, development of interventions and policies, and increase the value of healthcare equity, inclusion, and ethics on campus. Nursing students play a crucial role in the promotion of health and wellness on campus and are also able to help initiate surveillance and prevention of diseases. Nursing education must be flexible and adapt to the ever-changing demands and needs of the healthcare industry. Kolb's model of experiential learning provides the framework for nursing instructors to develop meaningful, interactive activities that engage nursing students. These activities help create a link between the formal classroom didactic education and real-world experiences. The skill of putting knowledge into practice is key in the development of proficient nurses. Promoting innovative experiences, focusing on the development of critical thinking skills, and encouraging students to thrive in a collaborative environment are crucial to effective nursing education. By promoting reflection following the experiential learning theory, the key concepts of what was noticed, why it happened, can it possibly happen again, the facilitator is able to guide those reflective conversations before, during, and even following an experience to help students open up to new and powerful thinking and learning. Ensuring that students have met all 4 steps of the cycle, having that actual concrete experience, trying out what they have learned in the classroom with active experimentation, reflective observation, reflecting on the experience, and learning from the experience with that abstract conceptualization. Thank you for taking the time to listen to my presentation and reviewing my information. I appreciate your time and hope you have a wonderful day.